Welcome to Aesthetic Revolution, the podcast. I'm Dr. Ed Zimmerman, aka the Dick Doc, your host today, and our topic that we'll be talking about, usually we talk about aesthetic things between the forehead and the feet with a concentration on what's in between, and this is in between. This is one of the questions we get from a number of guys who call asking about the happiness girth enhancing procedure and procedures in general, whether they have to be circumcised. So the hard cutting truth about circumcisions, especially adult circumcisions in the United States. So that's what we're talking about today. Statistically, there are about 1.2 million circumcisions in the world each year. Of those, about 55 to 65% of young males are circumcised in the United States versus the high 30% of young males are circumcised in the rest of the world. So it seems to happen more in the United States for whatever reason. There, of course, are religious reasons. People want to be like their dad or their brothers or the other males in their family. They want to look like the bulk of the rest of the guys in the gym. But there are some medical reasons to be circumcised, and there are some reasons probably not to be circumcised. We're not going to get into that bailiwick today. We're going to steer clear of that and talk about the actual circumcision and talk a little bit about the foreskin, the frenulum underneath the tip of the glands of the penis that connects the foreskin to the penis, and what the foreskin does, teleologically, what it does. So when men are born, when boys are born, they often have a covering over the tip of the penis, as do most, if not all, males in nature. And that foreskin, that extra tissue, is generally able to be pulled back somewhere between the first year of life and puberty. Depends on the human. There's not an exact time that it needs to be able to be pulled back. There can be adhesions that cause the underside of the foreskin, that skin that usually slides up and down, that covers the tip of the penis and protects it, perhaps. And those adhesions will often dissolve on their own, or sometimes they need to be lysed in order for the foreskin to be pulled back successfully after puberty for cleaning, if nothing else. Statistically, there are some potentially good reasons to consider circumcision. Women who have men as partners who are circumcised probably have a third less incidence of cervical cancer. That's a good thing. So HPV can be harbored and spread in that moist mucosal environment, the warm environment under a foreskin. Similarly, other STDs, including trichomonas, their rate of transmission in circumcised men is decreased by about 50%. So we know that some of these little critters are hanging out in that mucosal warm environment that the foreskin enveloping the tip of the penis provides. So that said, there are certain times when a foreskin gets in the way. If a foreskin is overly redundant, that a man can't have good cleanliness, or that it gets in the way of the tip of the penis having adequate sensation for relations, that may be a reason to consider either doing a dorsal slit so the foreskin can be reduced more easily, or removing the foreskin. There are certainly girth-enhancing procedures where the foreskin can, quite frankly, get in the way. So when we put filler or fat in that potential space between the skin along the outside of the penis and the hydraulics that are encompassed inside a conduit, that potential space we can fill with volume and we can girth up the shaft of the penis. But if that girth travels into the foreskin area, the foreskin can enlarge and it will not easily pull back so that it can inhibit the penis from being fully extended with erection. Or if it's erect, it can get to the point where not only can it not pull back, but once the penis has deflated again and become flaccid, the foreskin can't slide back over the tip of the penis. So we have those are phimosis and paraphimosis, and those are reasons to consider having the foreskin removed if it doesn't easily move up and down. Sensation has been hotly debated in our social media commentary. Some guys swear that the foreskin gives them more sensation when it's pulled back during relations. Other guys who don't have their foreskins anymore, maybe they don't remember, or maybe they had an adult circumcision, and we'll talk about that in a little bit, swear that they are more sensitive without their foreskin. So that's an interesting debate that will continue. Amongst adults in the United States, about 1 in 1,000 adult males have an adult circumcision, and that's very different from the circumcision that we do on infants in the hospital. Those circumcisions are usually done with one of several varieties, a Gomco clamp, a Sheldon clamp, a Plastibell, and it leaves a particular scar, sort of a waffly scar that we talk about where the circumcision has occurred that is characteristic. And when we're putting volumizers under the skin of the potential space, the area where the circumcision scar was induced during infant tribulation, well, it binds down a little bit, and we have to hydrodissect and lift that tissue up, lift the attachments up a little bit so that we can have a nice, gentle contour as we girth up the penis towards the tip of the penis and not just a sharp edge or sort of a shelf there. So that's a little bit of important technique that we've developed over time in doing the penis procedure. There are also implants that go under the skin sometimes, elastic implants that wrap around the conduit that contains the hydraulics, and those implants add between 1/2 inch and up to 1.5 inches, maybe even 2 inches at the base of girth to a penis, but it's girthy all the time and long all the time. But the foreskin has to be removed 6 to 10 weeks before that procedure can occur in order for the foreskin not to be trapped or to keep the implant from being placed properly up against the corona at the base of the glans penis. So foreskins have to go for that. But that said, if a guy has a foreskin and wants to get the penis procedure, we've done that on plenty of guys. We're just very careful not to let the filler migrate into the foreskin area as much as possible. So that's not been an issue. We do, however, do adult circumcisions, and they're kind of a fun procedure to do for guys who want to have them. They're not nearly as uncomfortable as one would think. So when a guy decides that, hopefully with his partner, that he'd like to forego his foreskin, then we do a little preoperative exam. We make sure they're in good health. We have no underlying bleeding disorders, elevated blood sugar, blood pressure, all those kinds of things. And we ask them to do a little manscaping, not shaving. We'd rather just have them trim. And they come to the office and we give them a little bit of very strong topical anesthetic. And that anesthetic puts the skin around the base of the penis to sleep and allows us to do a little ring block around the base of the penis. So Godzilla goes to sleep for an hour or two, doesn't much care what we do, and then we can get him all surgically prepped and everything like that. Now, adult circumcision is a lot different than infant circumcision. So we literally measure with rulers and calipers. We take pre-operative and post-operative digital pictures, and we measure girth and length and things like that. We need to allow enough redundant skin for the penis to stretch the entire length that it could possibly be when it's erect. We don't want the scar that's formed from the removal of the excess skin to inhibit the penis from growing either longitudinally or laterally in any way, shape, or form. But we don't want to have a lot of extra skin. The next thing is, instead of that ruffled, widened, spread scar that you see typically with an infant circumcision, we want to have a fine line. And we'd like to have the normal skin that's along the shaft of the penis come as far forward and then meet the mucosal skin that's just proximal to the corona of the glands in a pretty way. So it needs to be functional, it needs to be flexible, and it needs to be even and symmetric and nicely contoured. So we measure everything with calipers. We put the penis to sleep at the base. We make all our marks before we inflate the area that we're going to remove of the extra skin. We mark that with a surgical marking pen, so everything's done sterilely. And then in our case, You can use cold steel, you can use a scalpel, you can use electrocautery, but in our case, we use CO2 laser. And we actually remove the excess skin all the way around, according to our markings on the outside of the skin and on the inside reflection of that mucous membrane. The mucous membrane on the inside of the foreskin is very similar to the underside of the eyelid or the inside of the mouth. It's a moist mucous membrane. It responds differently. It sews a little bit differently, so it's a different animal. So, that said, we mark everything inside and out. We carefully excise in a nearly blood-free field the redundant tissue, and then we use absorbable stitches to bring the inside edges together. So the stitches are on the inside, so you don't have to worry about them. Now, sometimes we'll run several stitches or a baseball stitch along the outside. Again, absorbable stitches that go away on their own in a month or two, and they just become sort of a spider web and disappear. We ask you to abstain from relations for about a month, 6 weeks, to make sure that we don't spread that scar. Now, you're going to have erections and you're going to urinate and do all those things that the penis is meant to do outside of relations, but we don't want to do a lot of trauma because that tissue is basically spot welded together until it heals tight, which takes several months, but you'll be back in action at about 6 weeks. Dressings, we use a little bit of a Vaseline or Aquaphor gauze around the incision line, and then we wrap it with a nonstick dressing that just holds the penis at length so it doesn't accordion a lot, so that if you have any raw edges that are exposed, they can't stick to each other. So we keep that penis wrapped a little bit long. Sometimes we'll suspend it in a disposable jock strap that has a little hole cut into it, so Godzilla comes and hangs out for a while and has his little wrap around, and then you pull your shorts on over that. Whole procedure generally takes, an hour or so, probably 2 hours, start to finish by the time you get into the office, get into the room, sign your consents. Anesthesia is always a question. So some guys, they want to have anesthesia. Other guys, they want to have a little conscious sedation. We provide all that. We're a fully accredited facility. If guys want that, they can have that, but they don't have to. But they certainly can. Of course, if they have any sedation or anesthesia, someone else needs to drive them. Typically, we'll do a suture check at 3 to 5 days, and then if everything is healing well, guys are released on their own recognizance. We'll do another check at about 6 weeks, take out any stitches that are left, and at that point, they can also be prepped for any girth enhancement that they might like. The long and short, as they say, of the circumcision itself. Now, there are a few things that we run into when we do circumcisions that are kind of interesting. One thing is what some guys call the banjo string. So around the tip of the penis, there can sometimes be some adhesions between the underside of the foreskin and the glans itself. Those usually are absorbed or lyse or go away during puberty. But there's a frenulum of skin underneath between the glans and the foreskin, much like the frenulum that holds your tongue in your mouth, that sometimes gets stretched or sometimes has been stretched and broken again and again from trauma. And we get plenty of guys going, I broke my banjo string and it hurt and it bled. Yes, it did. That's something that's resected when we do a circumcision, an adult circumcision. We just put a little clamp on that painlessly, whittle it smooth and make it nice and smooth with the CO2 laser so it becomes a non-issue for you. And any additional little sebaceous inclusions or adhesions or things, those are all things that can be taken care of at the same time. Now, when you pull the foreskin back, sometimes you'll see a little growth. They look like little filiform fingers coming off. They're only a couple of millimeters. Those are pearly penile papules, and they're fairly common, actually. They are not an STD. They're just sort of a sebaceous inclusion growth, and those can either be left alone. There's nothing wrong with them. I don't know if they add much sensation, but they are a little scary looking to some people. So with some folks, we'll actually use the CO2 laser to very carefully sculpt those away so there's a nice, fresh, brand new baby butt smooth surface along the edge of the corona of the glands where they tend to locate. That basically is circumcision in a nutshell, talking about what it is that guys go through for an adult circumcision, avoiding all the ethical and religious considerations, but merely for cosmesis, maybe for function, and to be able to get girth enhancement in some cases. Those are the major reasons we do this procedure. So, if you enjoyed that, thank you for tuning in to Aesthetic Revolution, the podcast. Like, listen, share, all that good stuff. Comment. We love answering your questions. And come back and listen to the next session where we'll be talking about more procedures between forehead and feet with a concentration in between. Thanks for watching.